Welcome, everyone, and thank you for joining us today. Today we have GoHealth as our next presenting company. My name is Pat McCann. I'm an analyst here with Noble Capital Markets. Before we get started, let me just say if you have any questions, feel free to submit them, and we'll have a Q&A session at the end of the presentation. Without further ado, I will kick it over to Vijay. Go right ahead.
Thank you, Pat. This is Vijay Kote. I'm the CEO here at GoHealth. We do have a couple of disclaimers and normal things on forward-looking statements, et cetera. Please prize yourself of those at your leisure as we will commence with the rest of the presentation here. Here's a slide of our leadership team. I won't spend a lot of time on it. We'll have some time in Q&A if you do have any specific questions. But the short story here is this is a leadership team that has been very specifically pulled together to deliver a highly differentiated experience for a very complicated and necessary service that we deliver for Medicare consumers. I joined in June of 2022, and this team has been constructed since then. At that time, I also became a licensed insurance agent so that I can more directly, redefine how we're going to deliver service to our consumers. And we'll talk to you a little bit more about how we do that. If you go to the next slide, John, what you're going to find are our investment highlights here. I'm not going to spend a lot of time on them right here, but this is probably your Cliff's Notes sheet. This is what summarizes the key differentiators that make our space interesting and our role in the space unique, and then more specifically, how we are highly differentiated in how we're going to deliver the value proposition that meets these consumers' needs. Now, to take you over the overall industry and where we are currently within that industry, I'll give you the high-level stats. Big market, 65 million Medicare consumers. Most of you have interacted or understand the dynamics of the open enrollment periods and the annual enrollment periods and the shopping season, because you've probably seen all the ads on TV. You maybe have family members or loved ones who have gotten a lot of mail about this, but it's a highly complicated business or a process of selecting your Medicare Advantage plans. But it's a population that's continuing to grow. That averages are between 10 and 11,000 new Medicare beneficiaries per day. And over the last 5 to 6 years, GoHealth has uniquely served over 30 million shopping experience of Medicare consumers. And with our data, that triangulates to 10 million individual consumers who reach out to us to help them with this very difficult benefit selection process. Last year alone, we served 2 million Medicare beneficiaries trying to understand what benefit options are best for them. And in that process, enrolled over 800,000, delivering the financial results you see on the page. Over $700 million in revenue, $75 million in adjusted EBITDA, and more specifically, $109 million positive cash flow from operations. That's extremely unique. We're the only ones in the industry who are able to deliver this type of cash profile, such that we're generating cash and not burning it. And we'll talk about why that is so unique and why it is such a significant accomplishment given where we were versus where we are now. Going to the next slide, why GoHealth? We're going to really highlight some of the values focus of who we want to be and how we want to take care of consumers, and then how we use our technology, unique proprietary technology, deploying machine learning and augmenting with artificial intelligence to enable a better experience for consumers that lasts over the long term, and more specifically aligns with the cash profile of the business to ensure that we are self-funding our business as opposed to needing to continue to lever up to support growth. Going to the next slide, this is the overall Medicare Advantage marketplace. As I said, it's growing. What's really interesting is the health plans who seek us to be a marketplace opportunity for them to make their products available, have different margin profiles based upon different consumer types. So if you think the average Medicare consumer, 65 or older, aged into the population, they don't have chronic special needs. They're not low income. They wouldn't be what you would consider special needs populations. They have a margin of about 2.2% for the health plans. But special needs populations have 3 times that, 6.2%. And when you look at what the GoHealth model is and the population we serve best, we serve those with complex needs and lower income better than anyone else. And we attract them and serve them in a differential way, such that our share of the total enrollments we do are nearly double what the overall market is for special needs plans. And that's important because it also is a high value add for the health plans that we work with. So now if you move to the next slide, you'll see that we work with all the major health plans in the country, big names that you'll see. And not only do we work with them, given our model, we happen to be one of the #1 or the top leading producers of new enrollments for those carriers nearly across the board. And that has been a multi-year thing for us. We've done this consistently and continuously, driving very symbiotic relationships with health plans. But I do want to highlight one thing. When you think about what we did different in the business, starting in 2022, most of the industry still works in one way, and it is the way we used to work. And it's related to 3 primary constituents. You have consumers, that's obvious. You have us, who are brokers, and you have health plans. And historically, and the way most of the industry still works today, the brokers bring consumers to health plans. And that is, by definition, saying that the health plan is actually your customer. Now, with GoHealth, we switched it, and just a minor switch, but a material change in how we operate. And it's showing in our results. And that is that we say, no, what we do as the broker or agent, we bring health plan options to meet the consumer's needs. The consumer is our customer. So we must do no harm to the consumer, regardless of what anybody else in the ecosystem is looking to do. So now if you flip to the next slide, what you'll see is that consumer has a whole bunch of challenges today. They're trying to deal with all the information. They don't know who to trust. And it is hard for anybody to decipher all the plan options. When you think about the average commercial carrier or our employee today, any one of us on average, they have 3 plan options their employer makes available to them. And they're fairly easy to differentiate. One's an HMO, one's a PPO, one's a health savings account. When you get to the Medicare consumers, they have on average over 40 to 50 plan options, multiple HMOs, lots of PPOs, and you don't know which one is going to work for you. And so you need somebody to help you distill that information down. It's hard for an individual agent to do that. So if you don't have built for purpose technology that can really take that unique individual needs of that consumer, where they live, who their doctors are, who the drugs are, what their force prioritized benefits are. If you can't do that, it's going to be hard for anybody to decipher down to a handful of options to highlight for the consumer what those differences are and then empower them to make a decision. But that's what we do. That's what going to the right side of this slide is about. We use all those tools, all of our underlying infrastructure with our highly trained agents to be able to support this process. And the agents are still at the core of everything we do because these consumers are seeking peace of mind, not just Medicare coverage, peace of mind on their choices. And that is the probability of doing that is much higher when you're dealing with humans involved. So now if we go to the next slide, you'll see these are the different general modalities by which a consumer could enroll in a health plan, or their shopping process could be facilitated. One, they could know exactly which health plan they want to join. That could be in a health plan direct model. So they go to a Humana, United, they see their ad, they call them, they know they want to be on that plan. So they're going to call and they'll get an option that comes from that health plan. So that's where that consumer choice, where that's low. They're not going to get proposed any other products. On technology, they may or may not have technology to decipher all the options because the health plan agent doesn't need to do that. And this plan fit checkup is one I'll touch on when I get to our column, but there will be no plan fit checkup. It's rare that when a consumer calls in, the agent is going to just tell them to do nothing, especially if they're not already on one of that health plan's products already. Now in the middle, this is the traditional broker model. And so when you go to an independent agent, a consumer might assume that agent can find the best products available for them, of all the ones available, match them with it and enroll with them. But practically speaking, that doesn't make sense for an independent agent. It is a administratively challenging process to get appointed with every health plan in the country, even all the major ones. And so most independent brokers, traditional brokers, they will pick a handful of them. They'll get and they will enable a choice for that consumer based upon the options that are available to them within the ones they got appointed. So the consumer might feel like they have a lot of consumer choice, but in reality, they have more than the one plan alone approach, but not as vast as they probably want to feel comfortable and gain that peace of mind. Now you go all the way to far to the right. Of course, they're all green. We built the slide ourselves. But when it comes to consumer choice, we represent all the major health plans in the country, and they're in our marketplace. Technology, as I said, we got proprietary tech that helps match the individual needs of the consumer to all of the plans that are available. There are over 3,000 plans in the country. On average, like I said, 40 within your county alone. And then you need to decipher which ones are eligible for you and match your needs. We provide the technology to enable that in an efficient way. And then finally, this is the really important piece, and I'll double click on this in a second. The plan fit checkup. The consumer goes through that full needs assessment with our agent. We go through and get all the way to the end of finding the prioritized force-ranked plans available for you in your market. The top 3 are available. We know what plan you're on. You tell us. And if the plan you're on is one of those 3, regardless if we served you before to get you in that plan, my agent is going to tell you, you don't need to do anything. You should have peace of mind that you're in the right product for you, given your needs. And we're the only ones in the industry who are doing that and paying our agents to do just that. And so if you go to the next slide, what you'll see here is all of the, actually, let's skip forward one more if you don't mind. This model that we put together enables that consistent experience, because what we're trying to do is to make sure that when somebody comes with an intent to shop, we match them with the different products, we'll confirm them if they need to get enrolled in something or activate their benefits, but then we make sure that when they come back, we can continuously serve them. We're trying to build trust, so this is a continuous process. Trust is most significantly built when there's a situation where you could do something that benefits you that doesn't benefit your consumer, and you choose not to do that because the consumer's needs are most important. And we did that 100,000 times in the last annual enrollment period in the fourth quarter of 2023. Now, if you flip to the next slide, this is exactly how we demonstrate that. You take Marcus on the left-hand side. Marcus is not on a great plan today. He could go to a traditional broker or he can go to GoHealth. He's likely going to find a better plan for him, and he'll have a pretty good experience. Now take Ann on the right. Ann has a good plan, probably one of the best ones in the marketplace, and she goes to a traditional broker. Odds are that traditional broker is going to find another product to enroll her in. Whereas with GoHealth, with our plan fit checkup, she'll go through our process and our agent's going to say, look, Ann, you have one of the better products available for you. We think you shouldn't do anything. And if anybody ever questions you, whether it's in the right product, call us back if you're not sure, and we will reaffirm that it is the right one for you. And we leave her with very high confidence and trust in us. And that's because on the next slide, what we're doing is building this longitudinal relationship with Ann. Ann is going to shop, or should shop, for 20 years, at least once a year, because her needs change. Just because a product worked well for you last year doesn't mean the product's going to be exactly the same this year, nor are your needs going to be the same this year. So we believe everybody should be shopping every year. And today, frankly, not enough do. On average, probably only 10 to 15% are really shopping every year. And it's because of fear and all those other confusing things that people stagnate and stay in the product they're in, even though it may not be as good as it used to be, and definitely may not be meeting their needs anymore. So you can see every green dot here is where we do a plan fit checkup. We tell Ann, nothing's changed, your product's still the best for you, do nothing. But you see there's these inflection points. So she's diagnosed with a new condition, she moves to a new place, she needs a new physician of some sort, and she needs to switch plans. We support her in that. But remember, the CAC is decreasing significantly if you maintain that relationship with Ann. So we're investing a normal CAC at the front, and then much smaller maintenance CAC as you go forward. And then you're having multiple enrollment revenue generating opportunities off that. So it's a great experience for Ann. It's a wonderful experience of the health plans, and we can be rewarded, for the value that we're delivering in that system. So now if we move forward to the next slide, this is really the way you think about the seasonality of our business. I won't spend a lot of time on it, but the key thing to know about our business is, as you may have noticed in general marketing in general, is that annual enrollment is the biggest part of the year. That's October 15th through December 7th every year. That's when the health plans launch their new products and benefit options for the January upcoming, for the next full calendar year. They release those in the prior Q4, or what we call annual enrollment period. Then it goes into the next Q1, where it's open enrollment period. All those who have made a choice or joined a Medicare Advantage plan can make one switch. So that's the second biggest season of the year. And then the remainder of the year, calendar Q2 and Q3, that's when you start to have only those who have special criteria they're meet. Remember, I told you earlier, we get a disproportionate share of consumers who have special needs. Those special needs populations can generally enroll or switch plans once a quarter. And we serve a lot of those consumers during the special enrollment period. But the highest volume is in annual enrollment period. The second highest is an open enrollment period. And then in the special election period, Q2 is serving a lot of the population. And Q3, a lot of that is really preparing for that next big marketing season. So now we'll go to the next slide, if you could, John. Back to the summary slide for our highlights. As we said, a large growing market. We deliver a truly unbiased shopping experience that doesn't need to end in an enrollment. We have a unique that flywheel approach of the multi-step, 6-step maintenance, continuous longitudinal relationship process is unique to us, supported by our proprietary technology that's been built for purpose and continuously learning to enhance the machine learning as well as augment our AI capabilities. Our management team has done this work serving these populations for years, and we are uniquely positioned to continue to do more of our internal marketing to support these so that we are highly aligned with the regulatory landscape that we operate in, and frankly, ahead of the regulations that are continuously being updated every year. And finally, as you start to think about the high value product that we provide to the consumers, that is also delivering significant results for the health plans, such that our balance sheet can be strong to support our growth as we continue to develop and be responsive to the needs of the population. So I'll stop there and see if we have time, Pat, for some questions, or if you have any questions that have come in.
Thank you, Vijay. Yes, we do have some questions. Before I get to that, I just want to briefly mention that I do follow GoHealth for Noble and currently have an outperform rating and $22 price target. So if you want to check out the research, please go to channelcheck.com and give it a look. The first question we have has to do with the uniqueness of your platform. The viewer specifically mentioned Alight as a possible example of a similar platform. Could you touch on the uniqueness there?
Yeah, so I tend to not to want to try to get into apples to comparisons between peers, because again, competition is not my the peers who are in the industry are not my competition. My competition is stagnancy. And the key that we think is the differentiator for us is really leaning into building trust. Trust, trust, trust. That has always been the missing piece in the industry. And those who, once you lose it, it's very hard to get it back. And oftentimes within the Medicare population, that happens at the point of sale. Somebody told me something was good for me. I went to try to access it that way and it didn't work, right? And so what we have really invested in is making sure that we've gotten rid of the art of the sale for our agents. Our agents are highly talented. They understand the industry very well, but they need the tools to guide that process in a consistent way. So a consumer comes in, regardless of what agent they end up getting matched up with based upon where they live, they're going to have an exact same auditable experience. And what that enables is we can drive the compliance, regulatory compliance piece. We can regulate how the lead came in and the message that it came in on, and then we can ensure how we follow up with that consumer. So we have a lot of proprietary technology, as I said, 30 million interactions that literally nobody in the industry is going to have that many interactions with Medicare, to be the basis upon which predictability of saying, hey, when this type of consumer comes into our marketplace and rolls with this type of plan, they will likely have a higher satisfaction rating because they tend to stay longer on those products. We have that data for all of those shopping experiences and enrollments we've done over the years that enables us to be very intelligent in trying to do a one-to-one matching for a consumer to their health plan to yield the highest outcome. And more specifically, if they're in the right product, that we use that data to give them the peace of mind to tell them to do nothing. So that's maybe not specific enough for what you're looking for on the comparison, but that's the core of what makes us unique. And then ultimately, from an investor standpoint, we've also figured out how to avoid the diseconomies of scale of burning cash to grow, such that we generate cash with our relationships with health plans and the way we operate, so that we are a sustainable and self-growth engine.
Great. And then our next question is, could you provide an update to your expectations for the year regarding submission volume, revenue, and cash flow from operations?
Yeah, we in our last earnings call, we gave some indications as what we thought we'd see for the year. I'll stick true to what we had said before. No changes in those directional qualitative statements we made about our expectations for the year. We did highlight a handful of things that were going to be key as we think they could impact that performance, including the final rate notice from CMS as well as the final rule, both of which have come out with no material impacts to our views that we were already expecting for the full year. I think that's as far as I will go at this point. But really do appreciate the interest in understanding how those different market dynamics are still coming out. And the major factor that we highlighted on that call that is still unknown in a very specific way is the competitive dynamics and what the health plans will do with their benefits, because that's going to determine when it is going to be a good shopping experience for change for the consumers. And directionally, most health plans, there have been many health plans who've said they're going to be making negative adjustments to benefits, which will likely drive a higher demand for services like ours.
Could you, just piggybacking on that, could you tell the investors as a milestone, or as an event to look forward to, when is it that you start to see the shape of benefit changes? When will you have more visibility into that?
You start to get inklings when the annual notification of change goes out to consumers, more specifically in the late summer timeframe in advance of the annual enrollment period. But you really don't know for sure till they put all of the data out. They call it the window shopping period, which is October 1st to October 14th. That's when you really get to see the true details of all the benefit plans to know what the competitive differences will be and who will be affected the most. So for instance, in late summer, you'll know if health plans are leaving geographies in total, or they'll tell you what's minor changes are going to be available, but it's not in a systematic way that you'll know it. You'll have all the data available at the 1st of October.
Great. And then something you touched on during the presentation was the platform and how it will not recommend a change if a change isn't necessary for the consumer. Are there ways in which that can be monetized? Because of course that is helping somebody, that is helping the carrier who is retaining a customer. Are there any opportunities there?
Yeah, no, Pat, you hit it on the head. We wanted a proof concept. We start with doing the right thing. Our strategy is do the right thing first, and then it's up to leadership to go find a way to make money doing it, right? And what we did is we proved that we can do it at scale, and we did it at scale when we were tested with SAEP at 100,000 times. Now we've had a lot of interest from the health plans to say we'd like to support them. We're in advanced discussions with many of them to find a way to test being able to be compensated for doing that work. So think about it. The cost has already been borne for us. It's in our P&L. And now you're just going to be able to potentially add revenue against that cost, which is additive to our model.
Great. And then I think we have time for another question. This question has to do with, could you talk about the final 2025 marketing rule from CMS and also the final rate notice? Give a little more color about that and how that impacts the business.
Yeah, the final rate notice didn't really impact us directly. What was commission payments actually had a slight tweak up, but nothing of a material nature versus expectations in the preliminary rate notice that they had sent out. But what did come through in that final rate notice was there was no real improvement for the health plans. Typically, there's about 100 BIP improvement between the advanced notice or preliminary rate notice and the final rate notice, and there wasn't that this year. And therefore, what it really did was put more pressure on the health plans to have to figure out how to make their finances work when their medical cost trends are going up, which was predominantly a response from most carriers, was that they would see some pressure on the benefit offerings they could make available, and they'd likely either have to increase premiums or take down benefits for consumers. So that's relevant because it means there will likely be more disruption in the marketplace that would justify appropriate shopping and likely switching of plans, depending on where and how that happens. So that's the rate notice. When it comes to the final rule and the implications that were potentially there for those who are in the broker industry, there's been a lot of commentary from peer organizations, health plans, external advisory groups that have been all out there. And ultimately, in lion's share, what they've said is the compensation limits and a lot of the things that they were proposing, those rules don't apply to organizations like us, where our agents are really employees, right? The lion's share of our agents are W-2 employees who have a very small piece of their compensation tied to variable commissions. And so therefore, the limits don't apply to us in the same manner. There are some slight implications, which were really just advancing the schedule around the FCC, FTC rules on lead sharing and lead acquisitions, explicit approvals from the consumer to be shared with other third-party marketing organizations. But that said, it was generally a positive move from the way I think about what CMS is doing to protect consumers. And we appreciate them continuing to do that. But from a expectations financially, otherwise, no significant implications to us, as most of our peers in the industry has indicated as well.
Excellent. And let's sneak one more in. Can you talk about the company's marketing efficiency and how you will optimize that going forward?
Yeah, well, I think the beauty of the model is, and especially in this coming year, you want to make sure that you're using all the tools that are available for you to match your capacity with demand, right? And that is where the efficiency arises. It's not about all the modalities you can do, because ideally in most of this, and this is no surprise to anybody who's worked in the industry, mail is a very high valuable lead, right? Somebody comes with high intent, they know why they're calling, they know what number to call, and they're calling to shop, right? So it's a high intent shopper. But you can't predict mail to match with your supply function of agent capacity to stay efficient. So you use mail, you use TV. Again, those are, kind of come in big boluses of lead volume. And then you wrap it around with digital. And digital allows you to be very targeted and specific geography across the country. As time zones are moving throughout the day, you're able to match those up accordingly and then drive that. And unlike most organizations, we do a lot of our own internal marketing, and we can turn it on and turn it off when we want to, as opposed to having to buy whatever supply is available and not knowing necessarily the quality of that's available in the marketplace. So our efficiency is driven on matching the highest value consumers with the highest skilled agents, and then making sure that they have the qualifications that put them in the right product at that time. Knowing what the propensity of each one of these marketing modalities may be from a conversion rate or otherwise. So hopefully that's responsive, Pat.
Excellent. I appreciate that. I just want to, I guess I'll stop here and just thank all the attendees for being here. And Vijay, thank you for participating. We really enjoyed having you.
Thank you all for your continued interest.